Hi, my name's Andrea Daniels. I'm one of the pharmacists for Strive, as well as the VP of Clinical Services, and I'm so thrilled to welcome you to this episode of Strive Sessions. In this webinar, we are going to be speaking about hormonal health solutions. We'll be talking about progesterone, a very unique product to Strive called Elevate T, as well as Olympus for sexual wellness. Now remember, at the end of this webinar, there will be time for questions, so please stick around. So I have the opportunity to start by talking about progesterone. The first thing I want to do is thank you all for being here. Over the last 2 decades, there's been quite a stigma behind hormone replacement therapy. Since then, the FDA has reviewed some of that and has decided that there are actually a lot of benefits to providing hormone replacement therapy, both to women and men. That includes progesterone. So I'm going to take some time to explain progesterone to you, mostly in the capsule form, so you can understand the benefit of it for your entire patient population. Progesterone is an endogenous steroid hormone. It's produced by the adrenal glands as well as the ovaries and the testes. So that means our body makes our own natural progesterone. Now, progesterone is most often thought as a product that's utilized for fertility. When taken as a capsule, progesterone can also affect the nervous system. It can help with sleep. It can help to calm the mood as well, helping with both depression and anxiety. So as I stated before, we are going to focus on the progesterone capsule today. Now there's a couple different things I'm going to explain to you. Number one, when we compound progesterone, it is considered a bioidentical oral micronized progesterone capsule. What does that mean? So bioidentical or natural means that the progesterone is exactly the same as what your body makes. The chemical structure is. Now you probably have heard people say that, is your progesterone yam-based? Now let me tell you a little secret. So it's not just made from yams, but it's actually made from a chemical structure that's found in yams that's then semi-synthesized into the exact same molecule that's found in your body. So that's why we call it natural or bioidentical, because it's exactly the same. Now, OMP, or orally micronized, what does that mean? So progesterone is a pretty big molecule. If you were to take it just as it is, it's not going to be absorbed well in your body. But it is finely milled, so it increases the surface area in which the progesterone is able to be absorbed. So now let's take a minute to talk about progestins. Now, progestins are not the same as progesterone itself. Progestins are a synthetic version of progesterone. This oftentimes is confusing for both patients and providers. They're providing their patient with progesterone in what they think is progesterone, but it's actually this progestin. So progestin is not the same as progesterone. Unfortunately, it doesn't bind to the exact same receptors. It doesn't have the exact same activity. So patient symptoms might actually become worse with progestins as opposed to progesterone. So understand that the medications that are considered progestin or synthetic are not the same as the bioidentical oral micronized progesterone that you can receive from a compounding pharmacy. So this is a really interesting thing about progesterone. So when you take progesterone as a capsule, it goes through first-pass metabolism through the liver, and it's going to create different active metabolites, one of which is allopregnenolone. Allopregnenolone crosses the blood-brain barrier and hits the GABA A receptors, which are going to cause some relaxation. So that's going to help with sleep, anxiety, depression. It's a very unique action of the progesterone capsule, and oftentimes why the capsules are preferred over creams or troches that don't go through the first-pass metabolism. Now let's dive into some of our patients. So for women, progesterone levels vary throughout their lifetime. During puberty, progesterone levels vary, and then throughout the menstrual cycle or reproductive years, progesterone goes up and down in accordance with estrogen. Now, once perimenopause is hit, estrogen continues to be a bit erratic while progesterone continues to decline all the way until the time that we hit menopause and our progesterone levels are basically at zero. So what can we do for those women who are going through this process? Well, let's meet Jill. So Jill is me. Jill might be you. Jill could be your mom or your sister. We've all had people in our lives that have gone through perimenopause and menopause, and we hear about the symptoms, the hot flashes, the lack of sleep, the brain fog. Maybe they're losing joy in normal activities that they used to find great pleasure in. Let me give you a secret. Progesterone can help. So as we go through perimenopause, menopause, estrogen is oftentimes added to therapy, oftentimes added as a topical product, and it's important to add progesterone as well. So those who haven't had a hysterectomy, it's important to maintain a healthy uterine lining. This is going to help prevent any cancers. It helps keep everything nice and steady within the body. So adding progesterone to estrogen is very important. Now, I mentioned women who have had a hysterectomy. Those women don't require progesterone on top of their estrogen therapy, but when taken as a capsule, it can help with a lot of other signs and symptoms that they may be experiencing. Those signs and symptoms may include lack of sleep, maybe waking up in the middle of the night. It might include mood changes, or as I stated earlier, maybe just a loss of interest in activities that used to provide joy. So progesterone utilizing that GABA receptor, so again, the capsule that turns into allopregnenolone, crosses the blood-brain barrier, hits the GABA-A receptor, is going to help with sleep. It's also going to help with mood. We can provide progesterone capsules in multiple different forms, either immediate release or a modified release. I'll speak about them a little bit later. But know in those women who have trouble falling asleep and staying asleep, a lot of us wake up at 2 or 3 in the morning and we can't go back to sleep, that modified release or E4M formulation would really be ideal for them. Now let's jump to some of our other women. Progesterone can help with cycle regulation, PMS, fertility support, and even depression and anxiety. You can see here in this picture, it really supports women of all ages. Progesterone helps to support the luteal phase. So this is a phase of the cycle for the women. If women are having excess bleeding or non-regular cycles, adding progesterone can help to stabilize their cycles. Next, we'll hit on PMS. That goes back to our GABA story. So women with PMS have fluctuations in mood. Sometimes it even is fluctuations in sleep. So progesterone can help to steady out those fluctuations to help with PMS symptoms. Fertility support. This is one of my favorites. So it's important to maintain an adequate amount of progesterone to maintain a pregnancy, to even get pregnant, to create that healthy environment, that healthy uterine environment for implantation, as well as maintain a pregnancy. Women with recurrent miscarriages sometimes have low progesterone levels, so that might be a great way to support your women through their fertility. And last but not least, we'll look at depression and anxiety support. This is a story that I read. I thought it was quite interesting. During pregnancy, the placenta produces progesterone. At times, it will produce 10 to 20 times the amount that's normally found in that luteal phase. So at the end of pregnancy, we're uncomfortable. We don't feel great, but sometimes our moods are at their height because of the added progesterone. Now, once those babies are born and the placenta is gone, progesterone very quickly declines. Within 24 to 48 hours, it almost hits baseline. That's one of the largest hormonal drops in human physiology. So when people say they have the baby blues, there is a reason. This is a great story I read. It was a story about a woman who went into the emergency room. She was in a very depressive state. She was even becoming suicidal, and people were just kind of ignoring her signs and symptoms. And finally, a doctor walked in and really spoke to her, asked what's been going on in her life. She's like, well, I have a baby, a very young baby. And he knew immediately that it was that lack of progesterone that was causing these feelings and these symptoms. So this patient was given progesterone, and she was able to become the wife and the mother that she wanted to be. Now, progesterone may not be the answer for all of our postpartum patients, but it is something to consider when we're caring for those patients. All right, let's move on now to how progesterone is related to testosterone and how progesterone can help our men. Progesterone is converted into testosterone. If you look at this pathway here, progesterone is created from cholesterol. I don't know if I mentioned that earlier, but it is. And then you can see in the pathway, it actually becomes testosterone. So it's important for men to have progesterone as well. Now, dudes, it's also important for you to have estrogen, just not too much. We can talk about that later. But progesterone support in a man is important. It'll help with hormonal balance. So again, helping to provide an adequate amount of testosterone. Progesterone can help with sperm production. That's what we call spermatogenesis. It also creates an enzyme that allows for fertilization. And last but not least, it can help with men's sleep quality as well, and mood, just like it does in women. At Strive, we have a product called Test Booster. Test Booster contains progesterone for all of these reasons. It's often used in men that are wanting to increase their own endogenous testosterone while also maintaining fertility. It's a great product to look into for your younger men. Now let's talk about why compounding the capsule. There is a product that is available commercially that is bioidentical orally micronized progesterone, but it contains peanut oil, and not all of our patients can have peanut oil. Therefore, when compounding it, we can remove that allergen. We compound it with microcrystalline cellulose, or we're actually able to make it a modified release product using hypermellose that we call progesterone E4M because it's methicel E4M. Again, that's going to be ideal for those patients who have difficulty staying asleep throughout the night. Capsules are also convenient and systemically absorbed. It's going to be more predictable on a blood test. We do compound progesterone as both creams and chokies. They're just not quite as predictable. Progesterone is somewhat of a large molecule, so it doesn't always absorb into the skin as well. And when taken as a choky, it doesn't go straight into the bloodstream always. It is a lipophilic product, so it makes it a little bit more difficult. And a lot of the product is swallowed, which then will provide us with the allopregnenolone, which helps with the GABA-A, which helps with the relaxation, but it's not predictable. So this is why we most oftentimes recommend progesterone as a capsule. So let's work together and let's redefine well-being with Strive.
Back to talk on another medication, one of my favorite medications here at Strive, called Elevate T. Let's dive into what it is. Okay, we'll talk about the Elevate T, we'll talk about the mechanism of action, we'll talk about dosage forms, and certain talking points that you can use. So Elevate T is 4 simple ingredients. It's enclomiphene, DHEA, pregnenolone, and zinc. 25 milligrams of each. That all give the body the tools it needs to endogenously create testosterone or boost its testosterone levels. So first and foremost, enclomiphene. Enclomiphene is a selective estrogen receptor modulator, a SERM, S-E-R-M. It selectively blocks estrogen receptors in the brain, and it causes that negative feedback loop to kick in and increase our testosterone levels so that we can increase our estrogen levels. So that's how it works. I'll talk a little bit more on the next slide about that, but it's all going to come down to that negative feedback loop of hormone balance. The next 3, DHEA, pregnenolone, zinc, those are all building blocks that the body needs to naturally produce testosterone. So DHEA is a hormone precursor to testosterone. Pregnenolone, the mother hormone, also a precursor to testosterone. And then zinc, which is an essential trace mineral that the body really needs to produce testosterone levels. So oftentimes we're deficient in zinc, and that will show up and it affect our low testosterone levels. So a little bit more on enclomiphene, what it is, how it works. Again, we need to understand this negative feedback loop. So negative feedback is actually a good thing. It helps the body stay in homeostasis. So think of it as a thermostat. If it gets hot in here, the AC is going to kick on. If it gets cold in here, the heater is going to kick on. So the body works very similarly. So with testosterone, if I'm low on testosterone, the body will kick in this negative feedback loop. So I'll make more LH, I'll make more FSH, and I'll in turn make more testosterone. Now we know we get a lot of our estrogen from our testosterone. So if I take a capsule or a medication that tells my body that I'm low on estrogen, my body's going to kick in that negative feedback to make more testosterone, to in turn make more estrogen. So that's how it works here. The beauty behind this is that it's also going to increase LH and FSH numbers. So LH can make more testosterone. FSH is where we get spermatogenesis, where we make our sperm. So this is great because this can fall into 2 different patient populations for you. So first and foremost, if you have younger male patients who have low testosterone, they got their testosterone levels, they're lower and they want to increase those levels, they want to optimize their testosterone levels, this is a great option. Okay? We don't have to touch testosterone, we don't have to use exogenous testosterone. We can give the body those tools that it needs to increase testosterone levels naturally. Other patient populations that this medication works well for is patients who are on TRT, so they're taking exogenous testosterone and they want to maintain their fertility. They want to prevent hypogonadism. So 2 different patient populations, younger males with low testosterone who want to improve their testosterone levels, or males who are on TRT who want to maintain their fertility. Next thing here, what's really great about this medication is that there's no needles. We're not poking ourselves. There's no messy creams. This is a simple capsule. You would take this capsule 5 days on, 2 days off. And so you would tell your patients, take this capsule Monday through Friday before they go to bed, and then don't take anything Saturday, Sunday. So very simple dosing schedule, very easy to remember. And it's just a simple capsule that can have huge implications on the body. Again, we can work with two different patient populations. If we're trying to increase that LH will cause an increase in testosterone. It can also increase that FSH, which can increase our sperm production and maintain our fertility. So great options for both patient populations. Okay, last little thing, just kind of a recap slide here. So we talked about the simplicity of a single capsule dosing schedule. They just take a capsule before they go to bed, 5 days on, 2 days off, no injections, no messy creams. It's a non-controlled medication, so we're not dealing with testosterone itself, so it isn't controlled. So another thing to look out for. So that makes refills very simple for your patients. It's a good option for standalone therapy, so it's a good option for males who want to optimize testosterone levels. It's also a good option for patients who are on TRT and want to maintain fertility. It's just a way to give the body the tools it needs to produce its own testosterone. So again, we talked about endogenous, meaning the body's going to make it itself, versus exogenous. We're not touching exogenous testosterone. We're just building testosterone within our own bodies. It can promote fertility. It can increase our sperm count. It's a well-tolerated medication, very minimal side effects. One important note that if you are prescribing this, make sure you keep an eye on estrogen levels as well. So you will see testosterone levels start to rise, but it's tricking my body in a sense that my estrogen levels are low when they're really not low. So we need to also make sure that we're watching the patient's estrogen levels and make sure they stay in range. It's natural for estrogen to rise a little bit as testosterone rises, but if your patients start to become symptomatic, if they start to feel bloated or they get moody or nipple sensitivity, then that's a sign that their estrogen is getting a little bit too high and we should take a break or we can control it another way. All right, so that is it for Elevate T. Make sure to talk with your sales rep, talk to your clinical liaison. You all have access to a clinical liaison to learn more about Elevate T and how you can start prescribing it in your practice.
Olympus.
Bremelanotide.
Oxytocin.
Tadalafil.
The double or triple threat in sexual wellness. Sometimes it's tough to have conversations with patients about sexual wellness. Sometimes they find that it is very uncomfortable to talk about their feelings and their thoughts about it. You'll probably notice we have some interesting quotes on our deck today. They may be a little silly, but know that they might be great icebreakers to help your patient start to speak to you and open up to you about their sexual wellness.
So the three products that we're going to talk about here today, and we'll dive into each of them a little bit more as we go on. The first would be bremelanotide, which you might know as the PT141 peptide. The next one is oxytocin, or the love hormone. And finally, we have tadalafil, which we can do with or without in the Olympus Chokies, which can help with better blood flow. So let's dive in first and foremost with bremelanotide.
Yeah. So bremelanotide, like Joey said, was previously thought of as PT141. This is a peptide product. Here's a couple fun quotes about bremelanotide. Think of bremelanotide as flipping a mental light switch rather than just turning up the blood flow. This is the desire dialer.
I like that, desire dialer.
Right.
Another good quote here is, unlike other drugs, this one doesn't just get the hydraulics going, it gets the Wi-Fi signal to the brain connected too.
Yeah, so bremelanotide actually works within the brain. So bremelanotide is a melanocortin receptor agonist and works within the brain to help with sexual desire.
So unlike other medications where they can improve blood flow or change hormone levels, bremelanotide works with the desire center, making a connection with your partner. So we talked about before how oxytocin is known as the love hormone. Here's a good quote that talks about it. It says, if love had a prescription label, it would probably list oxytocin as the active ingredient. So oxytocin also works in the brain. It helps boost activity levels, pleasure, emotion connection with your partners. It's a very unique hormone that works in different areas of the body.
Most of us oftentimes will relate oxytocin with pregnancy and breastfeeding, etc., which all has to do with love. And that is a huge part of sexual wellness, is that emotional connection that you have with your partner.
All right, so the third and final ingredient in our Olympus Chokies, like I said, it could be with or without this, is the tadalafil. So you might have known tadalafil as a PDE5 inhibitor. It works great by increasing blood flow. It can work in males and in females, which we'll talk about a little bit more here.
Yeah. So here's some good quotes about tadalafil. Tadalafil is like the endurance athlete of PDE5 inhibitors. Think of it as the weakened warrior, ready for action up to 36 hours.
A lot of people refer to it as the weekender,
The
correct?
weekender, yeah.
So it can stick around, ready when you need it. So tadalafil is a PDE5 inhibitor. It works by increasing the cGMP via the nitric oxide pathway. It can help stimulate blood flow to the genital areas. So this can be for males or for females, like we talked about.
So tadalafil is probably going to be the product that you would be most familiar with within these three products that we've spoken of today. So it's important to know that it's not just a product for men, but it can be for women as well.
So here we have one more quote here. So whether it's bremelanotide sparking desire, oxytocin fueling connection, or tadalafil keeping the performance strong, Olympus is basically science's way of saying, we got you covered from the brain to the bedroom.
That's right. That's right. All right, now let's go over some of the products we actually do offer. First, you'll see that we have some that are just called Olympus. So there's Olympus, Olympus Max, and Olympus Plus. So Olympus and Olympus Max contain bremelanotide and oxytocin, the Max just being at a bit of a higher dose of those two products. Olympus Plus also adds in tadalafil. Tadalafil is added in this product as a 5 milligram dose. These products were originally created more with the female in mind. That is not to say that they're not appropriate for men as well.
Now, on the other hand, we had some created with the focus on males. So we have Olympus Peak and Olympus Peak Max. And you can tell a big difference between these is the amount of tadalafil that is in these. So Olympus Peak will have 20 milligrams of tadalafil, and the Olympus Peak Max will have the 20 milligrams of tadalafil, but 40 IUs of the oxytocin.
So while you notice these products differ slightly, they really could be used in each gender. It just depends on what your patient's needs are and how they respond to the medication. So Olympus at this time comes as a troche. So just a really small little tablet that's dissolved either under the tongue or between the gum line and the cheek. Now soon Strive is going to have the option to have these as dissolvable tablets. They will also be considered flex dose tablets, which is going to allow more adjustability in dosing. These products are used about 30 to 60 minutes prior to activity. The great thing is these products can be used in both partners. So while we did take some time to explain how each of the active ingredients works within this product, just know that they will all come together to help with desire, to help with pleasure, even to help with the physical aspect of intimacy.
So our hope here today is that we can get rid of the stigma and open up conversations about sexual wellness.
Yeah, absolutely. It's really important to address all parts of your patient with them, and sexual wellness is part of that. If you have any additional questions, you know you can always contact us at Strive. We'll stick around for some questions after this session. Thank you so much for joining us. Hi, everyone. It's so great to see you all again. I'm Andrea. I know I've probably met some of you before, been on these webinars with you, but today I have Joey with me. Joey just gave us some incredible information on Elevate T and helped me explain Olympus as well. One thing to remember, after this question and answer period, please stick around. There will be a survey. That survey is going to just help give us feedback as to how we can make these Strive sessions better, or information that you would like to hear from us. Please put any questions in the question and answer box. Otherwise, Joey and I we'll have a bit of a conversation. So Elevate T, Joey, where did Elevate T come from? Give us the background.
Elevate Tea, that's a great product. I actually had a chance to help build and formulate that one a little bit. It's a very good product that we have. Yeah, like I said, it can be used with or without testosterone, but it's a fun product to have on our formulary here.
Yeah, can you tell me how you felt different utilizing Elevate T?
Absolutely, yeah. So if once you optimize your testosterone, everything just feels so much better. Your sleep improves, your energy improves. I felt like I was just dependent on energy drinks all day long just because my testosterone was low. So once I optimized those numbers, everything just felt great. You know, like it was like I was younger. I was just living life, just happy to be at work. I can go home with some energy for my kids. It made a huge difference in my life for sure.
Yeah, that's fantastic. We have a great question here. It was asked, can we give Elevate T to women?
Good question. Yeah. So first and foremost, enclomiphene is the main ingredient in Elevate Tea. So a lot of females, especially female providers, if you've worked in the fertility side of things, you've probably heard of Clomid. Clomid is an FDA approved medication for females to help with ovulation. Now, Elevate Tea, the enclomiphene and clomiphene by itself to help with males to increase testosterone levels, it's formulated for male. It's an off-label use for males. So we don't recommend that women use Elevate Tea to increase their testosterone levels.
Yeah, Joey might have something up his sleeve, though, that can help with women's hormone and testosterone levels. Do you want to give us a little insight into that?
Yeah, so yeah, we do have a couple different products. First and foremost, we can do medications like Andrea mentioned with progesterone can help with testosterone production. We have a new product that's called Balance. The idea behind that is to help balance out female hormones, help bring down cortisol.
Yeah, so proud of Joey. Joey spent a lot of time researching and developing this line of supplements, and I know we'll have a webinar soon about his supplement line. But I feel like that is, a really great product to speak of while we're talking about hormones. So thank you, Joey. We have another question about bremelanotide, how to avoid the nausea. So this is something that's actually, it's a great question. It is a side effect. But I had spoken at the end of our webinar about how we are going to have the Olympus's flex dose tablets. Secret, they're out. Ready. You can order them for your patients. So it's so exciting because this is a tablet that has a specific flex dose design. It was actually designed by one of our pharmacists. So it very easily will split into 4 small pieces. So for patients that are maybe very sensitive to bremelanotide or sensitive to other portions of that medication, this allows for a lot of personalization. And personalization within prescriptions is really one of our main goals.
Super excited for those flex dose tablets to get released. Looks like we have a really good question in here from Monica for you, Andrea. So she says, how to introduce progesterone while taking estradiol in female patients? A particular time of the month, is that important?
Yeah, absolutely. It depends on whether or not your patients are still cycling. So if your patient is still cycling, you would give progesterone earlier in the cycle, and allow for a few days off or whatnot so that the woman can continue cycling. In your patients that are menopausal patients, and when they're that are no longer cycling, progesterone can be given, it can be continued. That'd be a better word for it, can be continued, and that's what's really going to help with that symptom relief. So it really depends on your patient and where they are in life, and whether or not they're currently cycling. So,
What do we have here?
okay, this is great. Jason, thank you so much for putting this in there. First, he gave a shout out to Ambria, who is incredible. Hopefully, she's on here and can hear that. She's one of our sales reps. Again, when you work with Strive, you have a sales rep to support you, as well as a clinical liaison like myself or Joey to answer the questions. Stephen asked about women with IUDs that don't cycle. So we're going back to progesterone here. So if women aren't cycling, if we're not, having the shedding phase or whatnot, progesterone can be used consistently. But if the woman is, wanting to have some sort of cycle, maybe once that IUD is removed, then you can use it in a cyclical fashion. So that's a great question. IUDs can be great, both hormonal and non-hormonal, but they may not always help to cover some of the effects such as sleep disturbances, mood, and whatnot. So adding the progesterone, especially as a capsule, as the orally micronized progesterone, is a really good option. So.
I love that you're the expertise on the female hormones. Females are complicated. They're tricky.
I know, I know. And we often get asked, how do I learn hormones? How do I learn how to do this? And I did take a second at the beginning to thank everybody here for being interested in hormones, and finding interest in helping both men and women. And we were all of us clinical liaisons were in a meeting last week when the FDA took the black box warning off of hormones, and I think there was a cheer. We were all just so thrilled. Thank you for being here. There are a lot of great resources to learn how to prescribe hormones. While we can be a resource for you, as pharmacists, we can help make suggestions or whatnot, but unfortunately, we can't help you prescribe. So just always keep that in mind. There is another question here about progesterone. I'll hit on, then we'll go to Elevate T. But there was a question asked: do you have progesterone that would be instant release to avoid morning sleepiness? We do. So the progesterone comes as both an IR, immediate release, and what we call E4M, which means modified release, basically. So that immediate release can be utilized in those patients who find that they have morning drowsiness. We also have it in a number of different strengths and whatnot. One thing interesting about progesterone capsules is bioidentical is that your patients who are doing testosterone pellets, it's actually recommended that a progesterone be added, in that they do recommend utilizing the bioidentical micronized progesterone. So now you know where to find it. Stripe. All right. One here for you, Joey. What are the possible side effects of Elevate T?
Perfect. Yeah, definitely important to know as providers. So, biggest side effect with Elevate T, as I mentioned before, Elevate T kind of tricks my body into saying I'm low on estrogen, but I'm not really low on estrogen. So, if you have patients who are on Elevate T, it's very important that you not only draw testosterone levels to check testosterone, but that you're also drawing estrogen levels. So, any side effects related to estrogen is important to keep an eye out. So that can be they're holding on to water, they have their nipple sensitivity, or they're feeling a little moody. Those are all things that can be tied into saying that their estrogen is a little bit too high. Much more rare side effects that can happen with Elevate T, with enclomiphene specifically. There can be some kind of vision changes, so watch out for that. And then there is a risk of increased blood clots, but again, very, very rare situations. But it's important that you guys have that knowledge with you.
Yeah, absolutely. And then this is kind of a bit of a follow-up, probably a great one for both of us, actually. But can progesterone be used in men, and what dose would we recommend? What dose would you often see, Joey, for progesterone with men? I know in our test booster, it's oftentimes around 20, 25 milligrams, maybe.
Yeah, that's pretty common. 20. Sometimes we see a little bit lower. I think the highest I've seen is maybe 40 milligrams, which is a little bit high. But yeah, around 20 tends to be kind of the sweet spot with progesterone in men.
Okay, fantastic. Thank you for helping me answer that one. Um, it looks like our question box has been emptied. Joey, do you have any other insight you want to give us? We didn't get to talk about Olympus too much. So, do we have any other pointers on that one or?
No, Olympus is great. I think it's really important. It's something that we stress a lot in Strive is to get rid of the stigma behind sexual wellness, right? That's something that's happens in men, in males, and in females. It's important that we get through that and we talk about that with our providers so that we can, fix the bottom issue. Just helps you make that connection a little bit better with your partner.
Yeah, absolutely. It's so great that it's actually three different products with
Yeah.
somewhat three different mechanisms of action. And it is a sublingual tablet. The
Yes.
new tablet that has come out is very similar to the Troche. So a sublingual tablet, so very easy to use, fairly discreet as well because it's just a teeny tiny little, I've been told, wild berry flavored tablet. So well, Joey, thank you so much for coming on, and thank you for sharing your wisdom. It's really been, so much fun to navigate some of these medications with you and whatnot. Joey, any last minute words?
Nothing from me. Thank you for this opportunity, and thanks to our providers for joining on.
Yeah, absolutely. Thank you. Have a wonderful day.